little bit about priority and queuing. So you were looking down on the check-in counter at Alien Airways. And at Alien Airways, you can become a priority customer by flying 3 million miles per year or by having the Alien Airways Express card. So those customers are allowed to line up on that right side here, and they get to use the red carpet. And everyone else has to line up here and queue and queue and queue until they get to the front of the queue, and then they can go into service when there's an available check-in agent. So we say that these customers have a higher priority, the premium customers have a higher priority than the regular customers. Now, as soon as a regular customer is in service, Alien Airways will process them the whole way through before they serve a premium customer. So even if there are regular customers at all three of these little countertops, this guy is not going to bump any of them out of service because we do not have preemption at Alien Airways. Why? Well, because for them to interrupt checking in that little customer who isn't premium in order to serve the other one and then start over on the non-premium customer is kind of a pain, and it would actually take longer. So in this system, we do not have preemption. Now, when would we have preemption? Well, let's say we went to the alien emergency room. So, the alien emergency room in the alien hospital takes in patients of varying degrees of criticality. So let's say that our premium alien customer trips on the red carpet and ends up in the emergency room with a broken arm. Now, while this person, who's a premium customer over here, is waiting to be seen by an alien doctor, this other alien arrives in the alien ambulance. Lights blazing. It's a hover ambulance. So this person is having a heart attack. So now this alien is much more critical than this alien for getting medical attention. So even if our premium customer with a broken arm is already being seen by the triage staff or by a doctor at the ER, our heart attack alien is going to go into service. If there's only one doctor, that doctor is going to drop this patient and make them wait so that this patient can be seen and get some attention. Now, if there are more doctors available, then a free doctor will go and treat this alien. So, but if there's only one, or if all of the doctors are busy, one of the doctors who's busy with a lower priority patient, somebody with a broken arm, is going to stop what they're doing to service this person. That is what we mean by preemption. So why would we use preemption, not preemption, and why would we use priority or not priority? Well, in the case of premium customers, it's all about business. We want our premium customers to be happy so they continue to keep bringing Alien Airways business and they don't go off and fly with the Klingons or somebody else. So there are a number of reasons you might do this. You might have priority jobs where you have, say, a spare part that you're machining and you need more of a specific type, or it's a higher priority part and you're going to stop the machine in order to have a different, or you're going to stop a process to process a different type of part. There are all kinds of possibilities for this. With preemption, same thing. If you have somebody who's enough of a burning priority to interrupt something that's already in service where you would pull them out of service, such as a medical situation, that's when we're going to use preemption. We are back again to the art and not necessarily the science, figuring out how you model this. Now, fortunately, most of the models are fairly similar. Your LQs, your expected number of people, of customers of each priority, is going to change depending on the system that you use, whether it's preemptive or not, and with priorities. But once you have your LQ, you can calculate the rest of those values, the L's, the WQs, and the W's using the same set of formulae, and they are in the notes.